much progress, we can say, has been made to end the status of this viral disease as a prevailing public health threat. But here in Jamaica, those efforts have included delivery of care, which includes not just medical, but social, psychological, peer support to enable people living with HIV and AIDS to live their best lives. We're updating guideline documents and facilitating programmatic reviews, reducing the barrier to accessing care for our key and vulnerable population. And so we've been true to our commitment. Jamaica's public health system is moving increasingly towards higher service delivery, and in this regard, it is indeed possible to reimagine the end of AIDS as a public health threat. But to see this goal's fulfillment, we must prioritize HIV prevention, care, treatment, and also to reinforce the partner support. It is then that we will find our national HIV response repositioned to success. In 2020, we became one of the first countries globally to endorse and to participate in global partnership for action to eliminate all forms of HIV-related stigma and discrimination. We're very proud of that. The use of data continues to drive interventions at not just the parish level, but also the regional and the national levels. Data quality has seen noteworthy upgrading at all treatment sites, and the result in an overall progression on the cascade. And so the fruit of our efforts involve enabling dialogue around issues that cause some of our vulnerable people and groups to experience shame. In this regard, we remain sensitive to the need for broader efforts to combat all forms of discrimination in order that those who are affected by and living with HIV have access to healthcare services. The Ministry of Health and Wellness, we will remain committed to delivering high quality and people-centered services for people living with HIV, and we will continue to ensure continued partnership across the sectors for the maximum impact.